am live. I continue reading Many Lifetimes. It's a cooperation between Dennis Kelsy and Joan Marshall Grant. They're both therapists. They both use hypnosis, but Joan Marshall Grant works in a very different manner because she is a psychic as well, and this is a recount of several cases. She passed away in 1989. This one is chapter 6, Reincarnation and Psychotherapy, and it is by Dennis Kelsy. And I've already read the account of one patient, and here is the second of these. And I continue. Today is the 13th of September 24. The second of the two cases arrived a few days later. The patient was a tall, wiry, athletic young man who suffered from the idea that there was something feminine about the shape of his hips. The idea was associated with feelings of guilt and inferiority, so intense that he had been unable to concentrate on training for a career and was ill at ease with both men and women. The knowledge that both the idea and the feelings were completely irrational was of no help to him whatever. He was an unusually good hypnotic subject, and I am satisfied that during the course of a long analysis I did not overlook any factor in his present life which might have been the origin of his symptoms. I managed to help him to the extent that he was able to derive considerable enjoyment from social activities, and also to complete an arduous training for a profession. But I knew that I had failed to solve his essential problem. After we had discontinued the analysis, he used to visit me perhaps once a year, but socially rather than professionally. I had not seen him for an unusually long time when he wrote, asking for an appointment because his symptoms were again troubling him severely. He was sympathetic to my new ideas and was obviously pleased that Joan was also going to try to help him. I induced hypnosis and told him to let his mind wander in search of the origin of his feelings, stressing that he would have no hesitation about expressing anything, even though it seemed improbable or but bizarre. Within a few minutes he began to describe scenes in which an elegant young woman appeared, always with a handsome escort. But the scenes changed. Abruptly, swathed in white ermine, she was alighting from a Daimler at the entrance to the Savoy, and then, without any threat of continuity, she was on the deck of a large yacht, and then in the paddock at Ascot. Joan handed me a note. This is a genuine recall, but he is not seeing the girl he really was. These are the girl's daydreams of the woman she longed to be. Tell him to see the girl herself. He quickly identified with her, using the present tense and becoming increasingly distressed as the story progressed. She had been the daughter of a small tradesman in a university town and had fallen in love with a title undergraduate. She believed he intended to marry her, and her fantasies were of the life she expected to lead as his wife, a role for which she tried to equip herself by poring over fashion magazines and society papers. But when she told him that she thought she might be pregnant, he was too scared even to be sympathetic, and said he never wished to see her again. She resorted to purging excessively hot baths and to jumping from a 5-foot wall, but none of these devices had the desired effect. She laced herself into a strong corset in anguished apprehension of the day when her remorselessly swelling abdomen must betray her condition to her parents. At 5 months, in desperation, she sought an abortion at unskilled hands. Many of the grisly details were described. The operation took place in the kitchen of a squalid little house, and was performed by an old woman, who presumably panicked or fled in search of help when she realized that something had gone seriously wrong. The girl died, still strapped down on the table, listening to her blood dripping on the stone floor as she became increasingly cold, increasingly terrified. It was the circumstances of this death alone and in fear which caused an element of her personality to become split off and frozen in a timeless present. The integrated components reincarnated within 2 years, but in a male body. Had this body been female, my patient might have suffered from an irrational fear of childbirth, or from phantom pregnancies. It is a tribute to his basic stability that although he was in effect being haunted by his own ghost, its appeal for integration was translated only as a feeling that there is something feminine, something shameful about the shape of my hips. The other aspect of this case, which to me was of special interest, was the fantasies which were seen both by the patient and by Joan during the initial phase of the session had appeared during the earlier hypnoanalysis. I had felt these scenes to be important and had urged him to enlarge upon them, but he had been unable to do so. I had offered various interpretations, including the possibility that the elegant woman represented the person he unconsciously wished to be. He could reply only that none of these interpretations felt valid, and there was no trace of the indignation which often indicates that a suggestion is correct but has been offered prematurely. In retrospect, this is not surprising, since he and I were thinking in terms of only a single lifetime. When discussing the case with Joan, I asked her how she had recognized that these fantasies, although highly relevant, were not memories of actual events. She explained that the clue lay in the fact that they were static and contained no action. This was because the girl was able to visualize how she would appear, but not what she would do in situations which were outside her social experience. Had she belonged to the same milieu as the man she hoped to marry, she would have seen herself playing an active part in her daydreams, in which case their true nature would have been more difficult to discern. The fantasies had persisted because the girl had directed such a large proportion of her energies into her hopes for the future, and then into her apprehensions of what would ensue if her pregnancy were discovered. It was this disproportionate quota of energy which had caused the fantasies to become condensed into constructs, having an independent existence of their own on the wish-fear level of reality. If they had been only ephemeral, they could not have been perceptible to anyone else. Had I followed the thread of the fantasies, which was offered to me during the hypnoanalysis, I might have unraveled this patient's problem very much sooner. But I could not do so because it led me beyond the limits of a single lifetime, which then circumscribed my approach in psychiatry. But when I no longer tried to fit the relevant material into too small a framework, his symptoms, with Joan's help, were cured in a single session. I think the word cured is justified, for he had no reoccurrence of symptoms during 8 years, and he is very happily married. The two cases which I have just described belong to the group of neuroses which are caused by fragments of the personality having become dissociated. The contribution of reincarnation is the recognition that such fragments sometimes derive from an earlier personality. But a far more common cause of neurosis is a defect in character. In cases of this type, the effect of reincarnation, perhaps surprisingly, has been to focus my attention less upon the patient's past than upon his present. The key to this change of emphasis, although I then did not realize it, had been offered to me in the different reactions displayed by patients when regressed to intrauterine life. For example, when reacted to sensations of discomfort by an aggressive desire to retaliate, others by trying to make themselves inconspicuous in the hope of escaping from further attack. I had also noted that the patient's approach to life when adult was essentially similar to that which he had revealed while still a fetus. But until I had widened the range of my concepts, I did not realize the essential point, that an individual incarnates with a character he has acquired during the course of his long history. And, moreover, that character is neither inherited nor moulded by the pressures of the environment, but is formed only by the exercise of the individual's power of choice. Outside pressures can cause a person to change his behavior, but only he himself can change his intentions. This principle is now the basis of my approach to the neurosis, which is due to a character defect, an apparently fixed tendency to repeat a choice which is unhealthy, because I have become convinced that no matter how long a person may have had such a tendency, nor under which circumstances it was originally formed, he can begin to change it at any moment that he decides to do so. The criterion as to whether a particular reaction is healthy or unhealthy derives from the undeniable fact that, with the possible exception of acute pain, the one situation which a human being finds intolerable is loneliness, the feeling that there is no one who is other than indifferent to the fact of his existence. And every action or reaction in respect of another person must either be heading away from loneliness or towards it, for it is to indifference that love will turn if it is not nourished, and to which even hate will eventually cool. The effect of reincarnation is to underline the force of the world eventually, for the end of a lifetime is not necessarily the end of a tendency to a particular type of reaction. The time must come when the approach of loneliness on account of unhealthy traits engenders a degree of anxiety which manifests itself as one or another of a wide variety of neurotic symptoms. But if the patient can be shown the aspects of his character which are threatening him with loneliness and can form the wholehearted wish to change them, then the change will begin and the symptoms will start to recede. I'll finish this here because it is a long chapter.